Today we will discuss what is appendicitis and what are the causes and how to diagnose appendicitis. Inflammation of the appendix is called appendicitis. First, we will discuss what are the symptoms and signs in the patient. In early disease, usually dull lower abdominal pain, which usually shift to the right iliac fossa with flatulence and bowel irregularities with anorexia. In late disease, there is a sharp localized pain which is localized to the right iliac fossa with nausea and vomiting and low grade fever. While in the late stage, it's usually high grade fever, and if not treated, then it will convert to the perforation. This image is showing there is a low grade fever with constipation or a diarrhea with nausea and vomiting, while the point of the pain is usually first in the periumbilical region and then shifted to the McBurney point. So let's come to the diagnosis. First, in the physical examination, there is a tenderness, then a rebound tenderness, and there is a Rove sign positive, which is if the pressure is applied in the left iliac fossa, the patient will feel the pain in the right iliac fossa. Other signs are the saw sign and obturator sign. In saw sign, when the hip joint is overextended, there would be a pain. And the obturator sign is that when the hip joint is flexed with the flexed knee, the patient will feel pain. After the physical examination, the first important thing is the WBC count in the CBC and easily available ultrasound. So now we will discuss what are the important signs to look on the ultrasound for the diagnosis of the acute appendicitis. On the ultrasound, there are the typical appearance of the inflamed appendix. In the right iliac fossa, there would be a peristaltic gut loop with wall thickness usually more than 3 mm. The appearance of this loop is usually concentrically layered, non-compressible, and blind-ended. This is usually sausage shaped and usually remain in constant position. The diameter of the skirt loop is usually more than 6 mm in conditions of acute appendicitis. In some cases, you can see phlebolith within the lumen of the appendix that is causing the acute appendicitis. The surrounding mesentery is usually inflamed and there is a very hyperechoic fat surrounding the acute appendicitis. If it is not treated on the time, this will lead to the either perforation or the formation of appendiceal mass. The definite treatment options are the surgical resection. So this is whole about the appendicitis, its signs, its symptoms, and how to diagnose on the ultrasound. Thank you for watching.